Clinical Psychopharmacology and Neuroscience article. Title is Effects of Methylphenidate on Somatic Symptoms and Brain Functional Connectivity in Adolescents with Attention Deficit Hyperactivity Disorder, a pilot study. This study aimed to evaluate whether somatic symptoms in adolescents with attention deficit hyperactivity disorder are associated with a dissociative pattern of functional connectivity within the default mode network, and whether methylphenidate administration can improve clinical and somatic symptoms. We also evaluated whether the improvement of somatic symptoms is associated with increased FC within the DMN in response to methylphenidate treatment. 15 male adolescents with somatic symptoms of ADHD and 15 male adolescents with ADHD without somatic symptoms were included. At baseline and after 6 months of methylphenidate treatment, all adolescents were asked to complete questionnaires for the Korean version of the Dupal's ADHD rating scale. The Symptom Checklist 90 revised somatization subscales, the Beck Depression Inventory, and the Beck Anxiety Inventory. Additionally, a resting state functional magnetic resonance imaging scan was conducted. Methylphenidate treatment improved clinical and somatic symptoms in adolescents with ADHD. In addition, it increased brain FC within the DMN from the posterior cingulate cortex to the middle prefrontal cortex. The improvement of somatic symptoms was associated with FC within the DMN from the posterior cingulate cortex to the middle prefrontal cortex in ADHD adolescents with somatic symptoms. Methylphenidate increased brain FC between the anterior and posterior DMN. The improvement of somatic symptoms in adolescents with ADHD was associated with FC within the DMN. The DMN in adolescents with ADHD seems to be associated with the severity of the clinical and somatic symptoms of ADHD. Thank you for watching Clinical Psychopharmacology and Neuroscience article.